Wellbeing Department here in San Diego. I am a policy analyst over here in the department, and Sarah Glass will be joining us shortly, and she is our deputy director over here in our prevention services. Both of us have worked within child and family well-being or child welfare services for a very long time in lots of different programs. So we do have a basis for the practical work that we do every day. And now we've moved over into our prevention services over here. We've got some things that we're going to be going through today. So we will be at an overview of what Child and Family Wellbeing Department is. It's a very big name. It's been changed in the last couple of years, so we'll talk a little bit about that. We'll talk about opportunities for system transformation, alignment with our current practices that we have, and then talk a little bit about hope in action. And then, of course, y'all can put in comments and questions in the chat. I might not be able to see them right away, so just we'll get to them, I promise. And we will have a small breakout session toward the end just to kind of gauge where we are within the room on where you see hope within child welfare, the opportunities and things like that. Okay. So Child and Family Wellbeing Department is a really fancy way of saying we were child welfare services, and now we're taking on a more holistic approach to child welfare service type of things. So in here, we have had a transformation in the last couple of years. I think it's been 2 years now. And we've really looked at, in the past, when you think of child welfare services, probably the biggest thing that you think about is foster care, right? We think that foster care is the primary level of intervention for our families who are involved in the child welfare system. And having prevention be the smallest amount of intervention and the smallest resources. And we know that that's not the way we want to do things. We know that prevention is really where we can make a really big impact to try and avoid our families coming into the foster care system, which we know has issues, right? We know that foster care should be the last resort when we're looking at intervening with families, and we want to help strengthen families. So in San Diego, we've looked at a way of kind of flipping that model of having foster care be the primary intervention and really changing that so that we can hope that prevention becomes the primary intervention. And we have a lot of different things that are helping support us in that move, which we'll talk about a little bit later. Just to ground us a little bit in what child and family well-being looks like, or child welfare, I will use those interchangeably. Don't tell my boss, but sometimes I get stuck in saying child welfare services, so please be patient with me. But when we're looking at our organization here in San Diego County, we know lots of different jurisdictions, states, counties, however the organization is run, looks differently in different places. So here in San Diego, we have some data that we have. It's public facing, so if you wanted to see it, you can on our website, from the last fiscal year, showing that we had approximately 40,000 phone calls that were made to our child abuse hotline. So of those calls, of the 40,000 that were called in, only about half were assigned to a social worker to go out into the home and check on safety. So that's, as you can see, 18,980. So about half of the calls met the criteria for us to go out and say, is everything okay out here? How can we help strengthen families here? Of those calls, so of that green section, the investigations, only about 1 in 9 investigations are actually substantiated, meaning that we found that abuse or neglect had occurred or happened. When we do find that abuse or neglect has occurred, only a small amount of those actually proceed to a case, meaning that we're opening services because we have some safety issues, concerns that we have for a family. And those can open either to a voluntary case or to a court case. Now we can see here that we've had 243 voluntary cases that were opened. And then below that are petitions, which means our court cases that we got court involvement for a family because our level of concern was so high was 628, meaning of that bigger 18, about that around 20,000 investigations that we had, only about 3.3% actually ended up having court involvement, but we still want that number to go even lower, right? One of the things that we're really proud of in San Diego is the fact that we've been working on trying to reduce the number of kids in foster care for a really long time. We know, again, that our system can create trauma for families. We know that we are not the best solution for most of the families that come into us. As you just saw in that chart, it shows most of the calls that come into us aren't even meeting the criteria for investigation. Most of them are, we do not find that abuse or neglect has happened on them. And so it's a very small percentage that become cases, and we're hoping to keep lowering that. As you can see here, in 2007, we had around 7,000 children in foster care, a really high number, right? And if you can see next, moving over to 2015, that number went down to 3,168 kids who were in care. And then moving even past that to 2025, so this year in January, we're down to 1,381 kids in care. That's a huge decrease, especially over that significant amount of time. We've been putting in a lot of work into different ways to engage our families, ways to change our internal culture on how we see work with families and how we move things here in San Diego, what our priorities are. And we will be going into that in just a minute. But we also know that there's still work to be done. Even though it says we have 1,381 kids in care, we know that we want that number to be even lower. We only want to have kids in foster care when it is absolutely necessary and there are no other options. Okay. So for those of y'all who aren't from the child welfare world, and I saw lots of you in the chat who are over here talking about First Five, we had some educators, we had some other different folks, and wanted to share with you kind of the basic flow of what it looks like when a call comes into our agency. You can see the little red circle, which means hotline. Most of the calls are screened out, which means that no one went out to see them because it didn't meet that level of need. And then we have an investigation. If they're most of the time, those are closed out. But if there needs to be investigation or follow-up that needs to happen because of safety concerns, then we have hearings. You can see the different kinds of hearings. I'm not going to walk through every step of this, but the point of this graphic is to really show you how many different areas there are within a child welfare organization where we can make different levels of impact, especially when we're talking about something like hope. Right? We have our voluntary levels, we have our hotline, we have our emergency response workers who go out and see those families initially, and we go all the way down the road to adoption workers as well. And all of these different points of time have different ways that we can make an impact with our families and infuse hope in different ways. So we thought to ourselves, like, what is it that we can do within our organization? Where is it that we already see hope in practice? What positive childhood experiences do we see? And what other areas is there room for hope to be infused? And so we did some asset mapping. I don't expect y'all to see every single little piece of this, but the point is that we found a lot of different areas where there's already overlap with our organization and where we can put hope into it. Now, we've been really proud in San Diego that we've been working, like I mentioned, on reducing the number of kids in foster care and working on having a strengths-based approach when we work with families. But we know that there are even more areas that we can make improvements. Here we have our community civic engagement block, and we did an asset mapping for each one of the 4 building blocks of hope, and we found lots of different areas of growth and opportunity. And this program was really fun to use for any of those who like to play around with maps. This was fun. Okay. So kind of moving forward into our current practices, like I mentioned, we had a lot of different ways that we see area for improvement and within hope. And so we know that we have a lot of different areas. So within San Diego, we have a lot of different frameworks and guiding practices that help us when we are working with families within our own teams and things like that. And you can see them here. We have our Live Well San Diego effort. We have safety organized practice, safety enhanced together values, and our prevention services. And we'll go into each one of these with some detail. So Live Well San Diego is really a big overarching framework or vision, a vision for our whole county, and specifically our Health and Human Services Agency. But Live Well San Diego is a vision for our region that's building better health, living safely, and thriving. So it aligns the efforts of individuals, organizations, and government to help all 3.3 million San Diego County residents live well. And that vision was launched when public health agencies were beginning to recognize how the conditions in which people were born, grow, live, work, and age contribute to a person's overall wellness and the health of the community, or those social determinants of health. So to address those factors, the vision leverages the diverse resources that we have here and the backbone support of the County of San Diego, and uses the collective impact model, which requires that cross-sector organizations come together in support of a common agenda, agree to track progress in the same way, and coordinate efforts to continuously improve programs and initiatives to positively affect quality of life here in San Diego County. Big words for we just want our county to be living and thriving. So that's a big level of San Diego County, right? But when we zoom a little bit closer into our Child and Family Wellbeing Department, then we can see some of the work that we've been doing here. I can't remember exactly when we started using something called safety organized practice, but I think it was, about 13, 14 years ago, something like that. And we have some safety organized practice experts in the room with us, so I'm sorry if I got that number wrong. But it's safety organized practice is a model that we use here in San Diego County in our Child and Family Wellbeing Department that's a mixture of a lot of different practices, including cultural humility, appreciative inquiry, signs of safety, solution-focused inquiry, structured decision-making, and signs of safety. So it's a lot of different things that are put together, and it's a way to ensure that we are using rigorous and balanced assessments in our interactions with families and moving into strengths-based interactions. So at the core of our safety organized practice are the 3 questions, which you see up here on the screen. It's what are we worried about, what's working well, and what needs to happen next. What needs to happen next? And so we use these simple questions because they're super valuable at each point of child welfare interaction with a family, and they elicit the voice of the family and help us focus when there may be a lot going on. So we use these questions when we interview families. So when we talk to parents, we use them when we talk to youth to help us get back to the root of our contacts and why we're there talking to the families. We also use them at consultation. So it's not just in our engagement with our families, but it's also in the way we interact with each other within our workspace, the way we talk and consult on things, whether it's an informal consultation between a worker and their supervisor, a supervisor and their manager, or our more formal consultations in our multidisciplinary teams where we are coming together to talk about a case or a family and see how we can make adjustments. Okay. And safety organized practice itself, it has a lot of different tools within it to help us with family engagement. And so these tools are heavily used with our workers and with our teams. And this is one example of a tool that we can use, and it's called the 3 houses. And so this 3 houses tool is where workers can help engage children and youth by asking them basically those 3 questions that we talked about, but in different terms. So it's asking kids to draw or write out their house of good things, all the things that are working well, the house of worries, and then our house of hopes and dreams. And honestly, I've used this tool many times with kids, and it's amazing what kind of engagement you can have with a youth when they're scared to see us coming out there and talking to them. But if we can have this kind of softer approach of being able to give them a creative outlet, either through their words, some like teenagers even do this with like writing in things into their house of good things and worries. And then with our youth, our children who are super young, can put in some really impactful things into these houses. For those of you who have used the 3 houses, I'm sure that you understand that. But we also know, or I know from my own personal experience with this, and as being a supervisor in our emergency response units, that sometimes it can be really hard to figure out how to ask the questions for the house of good things. While we try to bring a strengths-based lens into our practice, we know that child welfare organizations are naturally a more deficit-based organization, right? Like we are here to determine safety and risk. And so a lot of the time especially when we get caught up in our heads with all of our timelines and busy things that we have to do, it's really easy to default back to that house of worries and be able to start there with like, okay, let's just get into this. What are you worried about? And so I think one of the really nice things about the HOPE framework with our building blocks and our positive childhood experience questions is that it gives our staff even more language that we can use with the tools that we already have. So we can supplement the tools that we already have with additional language so that our workers feel more confident when using these tools, when communicating back on them. So that's just a little glimpse of safety organized practice. And then that kind of leads us into our safety enhanced together values. So safety organized practice, along with other best practices across our organization, have helped to build the foundation for our safety enhanced together values. I'm sorry if I use our acronym of SET values. I'll try not to, but I can't guarantee anything. But these values that you see up here, 6 different values, they help clarify what our practice standards are and why and how we use them across the organization. They also help to prepare families and partners to understand what to expect when working with us. It gives us some guidance on actions and behaviors that support our values that you might not even see here on the screen. But that we have guiding documents that have example behaviors that go toward each one of these values. And it sets the expectation that Child and Family Wellbeing Department operates as a learning organization as well, using data to drive decisions. This includes using data to identify strengths and challenges, to make course corrections when we know that something needs improvement, and to decide which practices and innovations to adopt. So what are we going to do next? And these also mirror our state and local priorities as well. And so these were developed a little over 10 years ago, just after our safety organized practice was introduced. And we're currently going through a redesign to refresh these guys because it's over 10 years old, right? So it's time for a refresh. And we're being really conscious to make sure that we're putting in information about positive childhood experiences and the building blocks of hope in each one of these values and each one of the practice behaviors that support these values. And so that's kind of a big level look at some of that, where we're going with hope. Now, I mentioned earlier that I'm part of our office's new prevention office, and it's called the Office of Child and Family Strengthening. So quiz at the end for everyone who can name all of the departments and programs that we have. Prevention is something that's really important because we have a lot going on in our country to support prevention. Over the last few years, we had some legislation called the Family First Prevention Services Act, or FFPSA, and that was signed into law back in 2018, and it changed that landscape of how we can use Title IV-E federal funding. So previously, kind of like on that triangle slide that I showed you, foster care was the primary intervention and the primary way that we could use Title IV-E federal funding. And now with this Family First Prevention Services Act, we're able to use those Title IV-E funds for specific prevention services. And the purpose of that is to really build on family strengthening. It has a prevention-focused infrastructure to keep kids safe at home, to reduce reliance on congregate care, and expand the use of kinship care in family-based settings. So moving from the federal level down to California. In California, we have our Family First Prevention Services Program, FFPS, which is a plan that was approved back in 2022. And the local Title IV-E agency's role is peripheral, and its purpose is to be the authorizing entity for prevention services that determine eligibility and maintain responsibility for supervising the activities of a community agency. Basically, like we have a community, well, we'll get into that in just a second with San Diego, but it authorizes us to either have our child welfare organizations or a community pathway that can lead to prevention services. And here in San Diego, we have a community pathway to implement the Family First Prevention Services Act. Within that, we have to use evidence-based practices to refer families to prevention services, different things like that. And then moving down to our local level in San Diego, we have a comprehensive prevention plan that really outlines all of the different ways that we are moving forward with prevention work here in San Diego. So we've embraced a family strengthening vision that is broader than the FFPSA and has reinforced that commitment to the reorganization that we showed earlier with the triangles. So our new Child and Family Wellbeing Department, I guess we're 2 years old, so it's still new. We'll still say that it's new. We're really working on strengthening and providing those prevention services to keep families together. And so the goals on here, we're working to prevent children from entering the child welfare system by providing family strengthening services in a more holistic and integrated way, trying to keep families together and hold the family as the expert in how to keep the kids safe, and trying to reduce unnecessary child welfare involvement in their lives because we know that we create trauma, especially when we are separating families. So. And then, oh, I see Sarah has joined us in here. Sarah, are you here? Are you around?
I'm here. Hi.
Hi, Sarah.
Hi. I'm sorry. I think we had like a really strong firewall and I could not get in here. So
okay.
It sounds like you did a really good job from the comments, Amy.
Woohoo. Do you want to tell us about our Family Connection Hub, Sarah?
I would love to. Hi, everybody. My name is Sarah Glass. I'm Amy's co-presenter for this session today. And thank you all for being here. Now that I have sidetracked us with the late entry, we want to share some of our work about the Family Connection Hub. The Family Connection Hub is how we intend to implement the community pathway in San Diego County. If you practice in California, you are probably very familiar with the term community pathway at this point. I hope you are. And if you don't, we are happy to tell you all about it. But this looks very intricate on the slide. However, essentially, this is our approach at a no wrong door entry for families that need prevention services in our county. And so this hub will link family to they are linking families to evidence-based practices throughout our community. And so one of the things that we've done is engaged with a lot of our stakeholders and partners to design this model and how we wanted our prevention services to look here. And then I think a unique thing that we've done in San Diego is these are contracted services. We heard from the community that they wanted to be served in the communities that they live in, that they trust. And so we were able to deliver on that part by putting out a request for proposal about 1.5 years ago, where we outlined what we were hoping for in this vision of a no wrong door here in San Diego for families. And so this is what we got. And this is not only for child and family well-being families, but this is also the vision for our local probation department for juvenile probation, so that there is a no wrong door for them as well. And so currently we can have social workers that are in our Office of Child Safety doing an investigation with a family. If that investigation resulted in an inconclusive or substantiated finding, then the family is eligible to get a referral to determine if they are candidates for Family First Prevention Services Act, and therefore a candidate for our Family Connection Hub. And I think we're about to share with you a little bit more about what happens once a family gets to the Family Connection Hub. And so the families are greeted with a care navigator. A care navigator is somebody who has some lived experience navigating various areas of the child and family well-being system. As you know, it's super complex. And so they're able to meet the family where they want at the family's preferred location. We have several partners in this work too. And so it might mean that they're meeting at a YMCA branch. And the other thing that the care navigators are doing, I think, a really, really good job of here locally is they're establishing some rapport and relationships with families. And so what we've seen is a very high engagement rate of families that are being referred to the Family Connection Hub, way higher rate than what we were actually expecting. And so I think what we're seeing is that being greeted with the positive childhood experiences scales being highlighted and recognized for the strengths that their family has. It's really building the engagement components that we were looking for. And so this has led to a lot of prevention plans being created with families. So they're able to partner with their care navigator, get assistance with resources in the community, have supports for removing some barriers, financial barriers that may come up for a family. And then they get ongoing support with their care navigator as they get enrolled in their evidence-based practices for their prevention services. And so we've just launched this in January of this year. And so we're still fine-tuning the details of it. But our ultimate vision is for this to really be a place where community members can make referrals, where families can self-refer, and where other professionals working with families that are struggling in the community, that they can make referrals to. And so there's some barriers to building that out the way that we want it to look at, but we're chipping away at them and slowly but surely expanding this as we can. And then a family gets to stay connected to the Family Connection Hub as long as they want. So if they have an ongoing need for services and it's going to take them, some time, then that's okay. And that's what we're here for. And what we're building towards is just for it to meet the family's needs when they need it. And so what we were able to do was be creative in our contracting process. And so when we put out this contract for the public to view, we made it a requirement that we were going to use the HOPE framework within this prevention setting. And so the proposal that we got back was really robust, and it really spoke to us and how we could really build this out with our partnering organization. And so what you see here is a screenshot of what it looks like in our child and family family well-being plan at our prevention services. And so we're able to really identify some goals for the family that's centered around the different HOPE building blocks. And so what we've seen is a lot of strengths come out of this process where families are putting goals on their plans. We even saw yesterday a goal come through where a family wanted to do some bike riding together and have quality time. And so they built a goal around that and how to get to that goal. And so I know that sounds really small, but it's a very different lens when you're looking at it from a traditional child and family well-being perspective. And so we're excited to hear about how this goes, but rather than me tell you, I think we have a slide that's going to share a little bit about from parents and actually from one of the care navigators that I'm very proud of the CBO that we partnered with to hire the care navigators. they are providing really high quality care to the families. And so you can see from that first quote on the parent, I didn't know what happened to me as a child could affect how I parent. And I don't want my children to be affected like this. I think that really speaks to the multi-generational trauma that we see happen in families that are exposed to child welfare. And it happens generation after generation after generation. And so, we have a care navigator here today. Oh, that's awesome. I just saw that comment in the chat, Amy. And so from a care navigator, Hope showed how powerful it can be when we take the time to recognize the strengths, not just the needs. It kind of reminds me of what Bob said in the keynote too, about just taking this approach, and you're starting at this approach. And it's much different than when you're reading a case file on a family that you haven't met yet, and you already have in your mind what's happened to them or the trauma that they've been through. And so this provides something a little bit different and a little bit more positive to lean into. And so this care navigator is really able to demonstrate how they were able to work with the family to get this mom a breast pump, help with childcare. And as you know, I think a lot of us know high quality childcare equates to child maltreatment reduction. And so just supporting families in this way, we think is how we're really going to get upstream and continue with the trend down on our foster care numbers.
Sarah, we had a few questions in the chat that are in the Q&A section that I hadn't been able to see earlier. So if, this might be a good time to just kind of check those out. So one of the questions is, are those prevention services that I talked about available throughout all of California with Title IV-E?
That's a really good question. And no, they're not, unfortunately. So it's going to depend on the county that you're in. So each county, I believe most, if not all counties in California have their prevention plans submitted and approved. And so you'll have to look at the county that you work in and see what evidence-based practices that county is selected to be part of their prevention services. And counties were very limited in what they were able to select. We only had the option of 10 evidence-based practices. And so there's definitely some gaps within those practices up and down our state, which is another reason why we thought it was very important for us to bring in HOPE at this time to implement them along with our evidence-based practices, because not every family wants to engage in an evidence-based practice. And if they don't want to, it is voluntary, and so they don't have to.
Thanks, Sarah. We also had a question about how we're dealing with child sexual abuse, which is definitely underreported.
I'll go back and read that question. I missed that one, but
Well, sexual abuse is not an area that is necessarily targeted within the comprehensive prevention plan, right, Sarah?
Right.
So we are still responding with sexual abuse within our organization when those investigations come up. And we are looking at ways to partner with different organizations on how to best support families for that. Some folks asked about the asset mapping tool, and that's called COGGLE, COGGLE. So just so you know. And then we were talking about upstream primary prevention when we were talking about prevention services as well. And then we had a question in the chat about how are we connecting to family resource centers. And so we are working on building up those relationships within our Health and Human Services Agency to make sure that our families' concrete needs are being met. Sarah, anything you want to add about concrete needs?
Sure. One of the things that we were able to do was build in concrete needs and supports into the Family Connection Hub model. And so what we heard we did a lot of community information gathering sessions when we were getting ready to design the pilot for our prevention work here. And what we consistently heard from community members and our professionals that are supporting families in the community is that families need concrete supports. They need access to food. They need access to childcare. They need help with their rent sometimes. Sometimes they need utility assistance. And so we were able to build that program into our model. And so families that are referred to the Family Connection Hub, if they are struggling financially, or if they are really, maybe behind in a utility payment, not able to afford groceries. We're able to assist with those things to really just help get that family stabilized before we start talking to them about going to an evidence-based practice. We all know, I think we can all agree, it would be very challenging for a family to get to their evidence-based practice once or twice a week when they aren't able to put enough food on the table for their family to eat every day. And so that's the reality that people are living in. And so we need to remove some of those smaller barriers to really make these things accessible to people. And so that's what we're trying to do.
Thanks, Sarah. And then we'll do one more question and then probably get moving on. But there was a question about, do you have data on sustainability of improvements in families? Are you seeing fewer repeat customers? Are families staying engaged in support systems? And so something I didn't mention when we were in this is that our prevention services just started. So we just launched this Family Connection Hub back in December, and we do have a pilot going right now. So we are working with families who had been involved with child welfare services and who didn't need a case open. So there are other different areas that needed to be met for them to work with the Family Connection Hub. But basically, we do have plans to do evaluations on this work, but we don't have really any information yet. Unless, Sarah, is there anything you want to add to that?
No, we just started meeting with evaluators just last week. So that's very brand new, but we do plan to evaluate this because we want to expand it and grow it, in an informed way to make sure that it's working and achieving the goals that we are setting out to do. So evaluation is definitely coming. And then I see a question in the chat about parenting classes. We do have parenting classes that we can refer families to preventatively, whether they go to the Family Connection Hub or not. So we do have we use Safe Care here. And I wish that was one of the evidence-based practices that was allowed in California for prevention funding, but it's not yet. So this slide is just kind of an overview on what we are hoping to do internally with our HOPE implementation at our department. And so one of the things that we are very fortunate, I don't know if Amy mentioned this before, she may have, but we are very fortunate to have a very strong working relationship with Casey Family Programs, and they have a field office in San Diego County. So we are extra lucky for that. They are our partners in a lot of the work that we do and our effort to transform our system here locally. And so they have funded the opportunity for us to become the first child and family wellbeing department to have HOPE weaved throughout our department in this transformation. And so we have just under 1,700 staff within our child and family wellbeing department here in San Diego County. And so they will all, from the very top, our director, all the way down every single level, everybody will be trained in HOPE 101 to at least have that baseline information about the building blocks and the model. So we are really excited about that. This is Amy's project that she has had for a few years now. And so we've been trying to bring this to fruition for a long time, and we're getting really close. So we're working on a training plan and how that's going to roll out for the rest of our teams. But what you see here is a very, very bird's eye view of what will be happening. And so we will have a really specific train the trainer cohort for people on our team. I'm going to mess up these numbers. I think we're training 20 trainers, right, Amy? Yes. Okay. Thank you. We're training 20 individuals to become train the trainers. And so that's our internal building, our capacity building for training. And so the 20 members of our team that are selected, they'll be volunteers. They'll want to do it. It's not, nobody will be forced to be part of it, but they'll get to train the rest of our department and also be a support in training our stakeholder partners. You guys saw the asset mapping that Amy did earlier. And so we are in collaboration with our partners that do this work. We have so many organizations, and I see many of you here that also do this. And so we're always seeking training from our partners. And so we'll get to be a training partner in return and help co-train. So we have a lot of ideas on how the co-training model can look here, and we're excited about that. And from the 20 HOPE facilitators, there will be 12 champions that will be trained as the HOPE champions for our organization. And so that'll be a much smaller cohort working with Amy and I on the bigger implementation throughout our department. And so what we're going to do is start this kickoff in a couple weeks with our whole leadership team. So we will have Bob and Amanda from the Hope team out in San Diego doing this kickoff event for a whole afternoon for our leadership team. And so they will get their overview at that time. And we're going to really set up the culture, our internal leadership culture for Hope, and how we're going to support this as a united leadership team. And so we're also going to lay the foundation for the expectation with our leadership team that our staff who are doing this work are going to have the time protected so that they're able to actually do this work and implement this with us. And so from there, we'll have that creation of an internal cultural of hope to really set the stage for what is to come, which is that community of practice. And so the community of practice is really where our 12 champions will be able to work with the Hope team and ourselves to really design the implementation pieces. And so Amy's going to share a little bit about that in a little bit. And I think the other part that is helpful for us to know is we get an opportunity to really transform what we're doing. So we can make our forms look better. We can upgrade the things that we've been doing for a really long time and upgrade these different tools. So we're very excited about this work and what is to come. And I don't know, Amy, do you want to add anything to that part?
Yeah, I just wanted to add that, I shared earlier a lot of different frameworks and values and practices in our transformation that we have. So we're also really aware of initiative or framework fatigue, for lack of a better word. We know that we want to make this as painless as possible for our staff, and hope is not painful. Like, hope is something that's going to help us in the ways that we already have been working, but really to enhance our work. So we are being really mindful that to not overburden our staff. So just kind of wanted to throw that in there as well.
I like that you added that. And I also want to add another piece. Amy and I's role is really around uplifting and leading our prevention efforts here to really transform the work that we're doing. And at the same time, we do not want to neglect the fact that we have a lot of child welfare programs that are decades old, and maybe they need transformation and they need this hope implementation as well. And so trying to simultaneously implement a new thing while also enhancing what we've already had existing for a really long time is what we're trying to do, is to bring everything along at the same time, even if it's a little bit staggered.
Thanks, Sarah. So we've talked a lot about hope as this big general thing, right? About how it's good for families and how it really benefits our youth. But I want to know details. So anytime I talk with someone about hope, they're like, well, what does that actually look like? So we wanted to come up with some areas that we are interested in working on as just a small overview. We know that this is going to be much bigger than just what you're going to see here. So we put together a few different things. I mentioned earlier consultations. So one of our big areas of work is around consultations, whether that's informal, formal consultations. Our staff who are working with families have to consult with their supervisors. Our supervisors often consult with managers. And then we also have formal consultations called multidisciplinary teams. And those teams come together to talk about those three questions I mentioned earlier: what's working well, what are we worried about, and what needs to happen next for our families. I used to facilitate some of those meetings, and I see one or two folks who also facilitated those meetings before as well. And we know that those meetings can get pretty negative because we are traditionally a deficit-based organization. We oftentimes focus on the safety and risk issues without looking at the whole picture. While we do have strengths-based efforts here in San Diego, we can still use improvement in talking about the strengths of families and how that builds resiliency. So on here, you can see over on the top where it says what's working well on the top of that arrow. That's what our form, a section of what our consultation form currently looks like. So you can see it. It's very exciting, isn't it? And this is one area where we can put in hope. If you see below is an area that I modified to show what it could look like, to change the wording, to include hope and positive childhood experiences by looking at the 4 building blocks as ways to look at what is working well or the strengths for our families. Oftentimes in our consultations, what ends up happening is we'll start off with what's working well. Tell me what's working well with a family. And what I hear a lot of the time is like, oh, they're cooperative, they're employed, or smaller things like that that don't necessarily contribute to the well-being of the that aren't a holistic approach at well-being for the children. But it can be really hard when you're in the middle of having to do an investigation or working with a family in a crisis mode. Sometimes it's hard for you to get out of that crisis mode. And so by taking some of these positive childhood experiences and putting that into the questions, we can really kind of hone in on what is the family doing to create those positive childhood experiences for their family, and can anything be built on to create resilience and to outweigh the safety issues that are going on. Okay. So another area that we have here is our child and family team meetings, or our CFTs. These are meetings that are held with our staff, with our workers, so workers, supervisors, we have a facilitator, the youth, the parents, a caregiver, all sorts of different people come into these meetings, and the purpose is to go over those 3 questions. Again, like I mentioned earlier, those 3 questions are everywhere within our organization. What's working well? What are we worried about? And next steps. And what we really see is that this is also a room for improvement when it comes to talking about what's working well. So when we have our meetings, we almost always start with what's working well. And similarly to our consultations, it can be kind of hard sometimes for our staff and even for our families to really talk about what's working well. Because when we get to these family meetings, it's not just our staff who might hone in on the deficits or the problems that are happening, but sometimes our families have a really hard time seeing what's going well for them. I mean, even if you think about for yourself, if somebody asks you, what do you do well in this area? It might be kind of hard to come up with something. So by using some of these positive childhood experiences, questions, we can really help guide that conversation on what's working well and create some new ideas for what needs to happen next. We know that focusing on positive things really does help with engagement, because if we're coming into a family meeting saying, here's everything that is going wrong, and we have a very long list of everything that's not working, it does not help with our engagement with our families. We want to lift up their voice. We want to lift up the positive things that are happening and how they are creating those good things for their kids. So I think that our child and family team meetings are a very clear way of how we can move forward with hope. Just mentioning those positive childhood experiences, these are some of the examples of different kinds of questions that can be asked to elicit that information. So asking about, like, what feelings do you talk about at home? Who can you talk to about your feelings? Where do you feel connected to others? What do you like to do as a family outside? All of these different questions can help us think of ways to bolster the strengths for our families. And like I said, sometimes we get stuck in our heads when we're doing our work in an investigation or in a case when we have a court hearing coming up or there's been an issue. And so sometimes having questions like this can really help us get out of our heads and come into some real meaningful conversations on strengths. Okay, so this is one of my favorite ones, y'all, okay? When we're talking about case plans, I think a lot of the people in my organization probably have wanted a refresh of a case plan for a long time. Our case plans in San Diego are not the prettiest things in the world. This is an example of what our case plan looks like the document that we hand over to families. This is a section of one that has been de-identified. And this is what it looks like, okay? It hasn't been updated in probably I don't know, over a decade, well over a decade. And it's generated from our really outdated computer system. And so we're really hoping, yeah, yikes, Roger. So we're really wanting to see areas where we can improve our case plans. Our case plans really focus on the goals, objectives, which are behavioral changes for our families, and then services that our families need to work on in order to move toward reunifying with their child or closing out that case. And so this case plan is really the guide for our families. This is the document that is supposed to help them understand what it is that is an issue, what it is they can do to really move toward reunification with their children. And so we took a look at that and looked at some different ways that we can play around with this. So if you are from San Diego, don't get too excited that this is going to be exactly what a case plan will look like. But we wanted to play around with some ways that we could infuse hope into our case plans. So one of the things that we notice is that our case plans don't really have any strengths written on them. Within our computer system, there is a tab in our computer program that allows us to put strengths in there. I can tell you as a former supervisor of a court program that we didn't always use that tab. And it's not because we didn't see the strengths within our family. It's because at some point our case plans become another thing to check off the list, just realistically. But we know it can be better. So one of the things that we talked about was having a section about family involvement in case planning. So eliciting their voice. How was the family's voice used to help create this case plan? We talked about family strengths as it pertains to the 4 building blocks of hope. So having a way to talk specifically about what is going well with our relationships, environment, emotional growth, engagement areas, and really being able to write some of that out. And even just making our case plans a little bit friendlier to look at, but also, also accessible to our families. And so this is just kind of an example of what it could look like. And even when we're thinking about our services to our families, we have a section on our case plan for the youth, even for babies. There's a section about services or for their medical, their dental issues, but we don't have something specifically asking workers to look at culture. So thinking about that engagement, and we would really like to see something about culture being included in on here. Who is responsible for making sure that a child's culture is attended to when they might be in a placement that is not a family member or a kin placement. And then also looking at ways to have emotional growth and enrichment within our case plans. So thinking about extracurricular activities for our youth who are in out-of-home care. Now, this case plan example was for a baby, but if there was a child who was a little bit older, possibly having in here access to a soccer team or a dance team. Sorry, those are the things that are on my mind because I'm driving my kids everywhere right now. But really trying to make sure that we are attending to those needs because we know that that's a very important thing for a youth, especially when they've been having so much change in their lives. Okay. In addition to kind of looking at consultations, at our family meetings, and then even specifically our forms with our case plans or other things, we're also looking at ways to include information on our contracts. So just finished a contract the other day. Our amendment got signed and everything with one of our, it's a therapeutic preschool that we have here in San Diego that works with families who have experienced trauma. And so we put in hope within the contract here. So we see a lot of overlap with hope and our trauma-informed practice that we already have. So these trauma-informed principles that you see up on this screen are a piece of our contract that is normally in there. It's always in our contracts. And so we wanted to make sure that we also included information about how positive childhood experiences are important in kids' lives, and about the 4 building blocks of hope and the framework there. And that this is something that we expect our contracted partners to know about and then help support. What you don't see up there is that also within the contract, we had information about including a Hope 101 training for the staff at the preschool, and then even including handouts on positive childhood experiences to be able to give to the parents or caregivers of the children who go to that program. Our partner at the preschool was really excited about the idea of hope, and I know that they're even thinking of other ways that they can put hope into practice at the preschool, which really aligns with that pretty well. Right. Okay. Just wanted to take a moment to stop and see if there are any questions so far. I just gave a lot of information of examples. Okay. Well, we are wanting to see kind of what your thoughts are. Sarah and I could talk this entire time, but we think it's more valuable when we can have more discussions. And so wanted to kind of look at these questions that we have up on the board of like, what challenges do you see in incorporating the HOPE framework in child welfare? What needs to happen to make this narrative change? How would you like to see the HOPE framework show up in child welfare work in your community, whether through policies, partnerships, or family support efforts? And which of the 4 building blocks do you see most often in your current practice? And which do you think needs more intentional practice? And so I'm going to put those in the chat. I can't put them in the chat because I can't put that much. So I'll put them one at a time. But I'm going to put these in the chat, and then we're going to do a breakout room for maybe like 15 minutes to just give you an opportunity in groups of 4 or 5 to be able to talk through whichever one of these questions is calling to you. So hopefully throughout this presentation, you've been able to kind of think about it's activated your mind on your practice or what you would like to see within your community. And so we would really like to open that up for y'all to have an opportunity to work on that. So I think our person will be putting us into some breakout rooms shortly. Welcome back. It's always hard to gauge how long to have people in breakout rooms and meetings like this. So we hope that you were able to have some nice conversations with the folks in your group, or if you weren't, you were having some nice introspection on HOPE. Yeah. And then I'll just show the questions real quick again, and we'll get moving.
I'm hoping the conversations went well. We would love to just do a few minutes of a debrief with you all and see. So I don't know, was there a question that spoke to anybody or anything that you're doing currently that you want to share with us? Because we would love to hear. I was reading a lot of where everybody's from and the organizations that you're working with. And so I see a lot of partnering organizations that maybe you are either contracting with your local child welfare agency, or you support the families being served in open cases or investigations with the child welfare agency. Did anybody see linkages to your work and how things could be a little bit more aligned where you're practicing? Don't be shy with us.
I can share.
Okay, share.
So I was telling my group I'm really super excited about the Hope Framework. I was the first person in my organization. I'm in California, Sacramento, California, and I work for the Child Abuse Prevention Center. And we work really close with the family resource centers here. And we incorporate protective factors in all of our trainings. And now we're able to incorporate hope in all of our trainings. And so that's something I've been working on for the last probably like 6 months, is we had to start with like a base hope training that is applicable to our resource centers. And then now we're able to just incorporate them into the other trainings like home visitation and impacts of violence on children was a really good one. We dedicated a lot of time to hope. And so that's something that's really exciting. And I actually love the handout that you guys put in the chat. I was looking at all of the questions because where we struggle is with SMART goals, is the home visitors specifically are having a really hard time with this idea of pulling hope and just strengths in general into goals that are supposed to be focused on whatever challenge they have going on. And so these questions I think are going to be really helpful to just incorporate in some way for training purposes.
I really like that, Courtney. You guys are doing some really cool things there too. And I would love to, I know Amy and I would like to connect with you more after this about your work with the family resource centers, because that is one of our next steps, is to really look at that as we start to expand our community pathway and really looking at the places where families are served. And it seems to be a lot of FRCs. And so we would love your tips and advice on that when we get to that point. Thank you. What's everyone else doing? Or where do you see the alignment, or where do you see the opportunity?
I can also share. So I'm from Child Advocates of Silicon Valley. We're up in Santa Clara County, California. And right now we're really focused on PCEs and making sure we work with the CASA program. So we unfortunately don't get to intervene before the detention happens, but we're working with our CASAs and we're tracking PCEs each month to see how many PCEs our CASAs are engaged with in each interaction with our kids. And we've kind of really brought this PCE focus into our entire framework. And we actually just had a conference with our CASAs, our yearly CASA Summit. And we really focused in on PCEs, both how can you kind of engage with them in actions, but also we have a thing called a CASA store at our site where kids can come and CASAs can come and get things for their kids. And we talked about how can we use these physical items to help with PCEs and with those experiences.
I really like that. Thank you for sharing with us. Did anybody, or Roger, you go. I saw you come off mute.
I was just going to say, it's really great to see the kind of model that you guys are providing, because I think as, a lot of child welfare programs, I'm with the Children's Trust Fund, so in the Prevent Child Abuse America chapter, so we're kind of on the same side as the folks who've already spoken. But we work closely enough with our child welfare system and try to advocate for some of these types of changes. And there's movement, I think related, to Family First, that is moving it more upstream, but really we're in a much more secondary prevention. They are in a much more secondary prevention mode than really looking at any of the kind of family strengthening work that we'd like to see more happen. So what you're doing, I think, is really incredible in terms of being able to show a model, of what can happen when you use these kind of modalities. And I know you're early on in it too. So, but hopefully, we can use that to help promote within our own states. So thank you for what you're doing.
Thank you. Appreciate you. Well, we would like to just also acknowledge that we're really fortunate as a child and family wellbeing department to have the partners who started this work before us. There's a lot of network members. We put a few of them on here and their logos. We didn't put everybody, but these are the organizations in our community that have really helped my team and our department uplift some of this and offered us trainings and support, and really helped us try to grow this year and advocate for it. And so these partners are invaluable to us. Many of them are our partners in prevention services programming. And so we're happy that this all aligns. So I saw some questions in the chat around building, getting child welfare leadership to be engaged in this and involved in this. I know that is a barrier at times. They're spread very thin, and there's always a lot to do. It's a job that you are never bored in, not one day of your career, as many of you know. And so it's very busy, but I think the emphasis is here around this. So if there's any way that we can support your effort in that, we would be happy to. But we did want to acknowledge our existing partners and show our appreciation for them. And we want to open it up for any questions that anybody has. I was trying to go along and type responses, but if you have any questions, feel free to just come off mute and start chatting with us, or those are our emails. Amy and I are leading this project for our department. You are welcome to reach out to us anytime. She put a QR code on there.
That's for my email address.
Oh, okay.
For my email address. So if you're the type who just likes to do QR codes, just thought I'd throw it out there. Give us any feedback. Like if there's something that you think of that we should be doing to implement this here, we want to hear from you. So give me an email, anything like that. Okay, and then
Hi.
If there are any other questions, I think.
Hello.
I saw
Hi,
a question from Miriam in the chat around if we're aware of any resources on the HOPE framework in Canada. And I'm not, but I will tell you, Amy and I go on the HOPE website all the time, the resource site, and we look at all these briefs that they have. And those are very helpful when there's one in particular, I think it's called Working with System Impacted Families, something like that. That one's very helpful when you're trying to explain it to others that work within a family serving system, not even specific to child welfare, but we've used that in talking with our probation partners about this framework to really help them understand what we're trying to do. So I would recommend using those tools. And I don't know if anybody has any questions.
Well, I have a comment from Kinaya Shakoya. I was thinking, this is a wonderful, wonderful framework. I really love it. Even in its early stages, this is great. I was thinking in terms of, you said you're using a train-the-trainer approach to kind of, and I think you're developing a team. I don't know if you've thought of this, but it might be helpful to in the training, have your staff kind of look at their own positive childhood experiences and adverse childhood experiences and kind of see how it works in the real world. I mean, you are the real world, but still, if you're going to be going out training, I guess we need to kind of have some empathy or a little bit more knowledge about what's going on in the families that are being served.
Thank you. We really appreciate that feedback, and I think that's something we can definitely talk to our team about.
Hi, this is Miriam Silman from Kentucky, and I'm really looking forward to seeing your some data from you guys. And I have a thought. I think that one of the questions that we didn't talk about in our breakout group, but that I often think about is which of the building blocks is the most challenging. And I think in child welfare, that engagement building block is going to be a really important one to measure, but to measure very carefully, because in the current models of child welfare, engagement is so black and white. People are either engaged or not engaged. They're resistant. There's all kinds of language that we use. There's all kinds of ways we frame it. I think we've done a better job of understanding what both the practical and the perceptual barriers can be to that. But I think from a research perspective, I hope that you guys will really give some thought to some nuance and how you can capture that, because I think that that's going to be one of the things that differentiates a hope-infused child welfare approach from the status quo way of doing things. So I just wanted to put that out there because I think a lot about how to measure that and how to think that through.
I totally agree with that sentiment. And I think we've only talked about evaluation really just one time with this, but I think we have to kind of look at it as a mini evaluation of each building block to really look at, like, where are the areas of strength around our practice, and where are the gaps and why are they there? And then how do we keep working to improve those? I totally agree with that. Thank you.
It's my favorite building block. So yes.
Yeah. And I even think that getting a measure or getting some understanding of the level of engagement of the staff. Like, I think that one of the things that that in child welfare has been a survival mechanism is to disengage to a certain extent, right? And because it's protective. And are you seeing something different? And then, and what does that mean? I mean, clearly there's going to be some ways of countering the vulnerabilities that may bring up, because there's a hope-infused supervisory system in place, and all of the culture is going to support that. But I think that from both sides, that engagement piece is going to be critical.
Yeah, one of the things I'm excited about is working with our whole leadership team on this, and how do we implement hope, not just for the families that we serve, but for the teams that we supervise, to really look at retaining our staff in child welfare. I know that is a challenge in every child welfare department across the whole world, but we've seen that challenge here too, and we've seen a lot of improvements in our retention lately. And so we're really thinking this is the time to strike with this and look at how do we really support our workforce with this model as well, and make it really multi-layered at really parallel for all parts. And I think we have to end because it's 11:30. So
thank you for your time. I think this was really nice to be able to have some good comments and questions in the chat. We're really excited here at Child and Family Wellbeing to be putting this into practice and getting the rest of our team on board with it, because Sarah and I have some good ideas, but we know it's the ideas of our staff, and hopefully even getting some input from our families on how we can include this as well. So thanks, y'all.
Thanks, everybody.